Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
This deep dive was created using generative AI tools to support accessibility and clarity. The content is grounded in the research and instructional work of Dr. Michael Jones. Welcome everyone to the deep dive. Today, we're taking a deep dive into an area that's really reshaping things in mental health: cultural considerations and diverse populations in telemental health. Our mission today is really to unpack the key insights from the source material on this topic. We want to give you a clear picture of, the opportunities telemental health offers, but also the significant challenges when working with diverse populations remotely.
That's right. It's a fundamental shift, really. Telemental health isn't just some add-on anymore. For a lot of people, it's now the main way they get help. And the critical thing to grasp is that cultural considerations here, well, they're way beyond just basic translation. It involves really understanding how technology itself mixes with cultural identity, how people access care, and maybe most importantly, how it changes the therapeutic relationship itself.
That's a really important point. So when we talk about telemental health, the basic definition is using telecommunications tech for remote mental health services. Simple enough, right? But here's the thing often missed. Ethical guidelines, like the ACA Code Standard H2A, they don't just say do teletherapy. They actually require specific cultural adaptations. It's not optional. It's essential for good, equitable care online. So the real core challenge seems to be this balancing act. How do we grab these amazing opportunities telemental health presents without making the existing challenges for diverse groups even worse?
Exactly. If we want truly culturally responsive telemental health, we need that deep understanding of how tech interacts with culture and the therapy dynamic. And this is where multicultural competence in the virtual space becomes so vital. It's really an emerging field, learning how to use these digital platforms to actually enhance understanding between therapists and clients from different backgrounds, which can be incredibly powerful, but also uniquely tricky online.
Right. To really get into that, let's define some key terms. These aren't just jargon. They're foundational for thinking about responsive care, especially in this digital context.
Definitely. First up, cultural competence. Often defined as, providers meeting social, cultural, linguistic needs. But in telemental health, the real question is how you achieve that online. It means developing a kind of digital fluency, picking up on cultural cues, maybe even biases that might present differently on screen. Then there's cultural humility. And this isn't a one-and-done thing, it's lifelong. It's about acknowledging everyone's unique, intersecting identities, constantly reflecting, and being ready to learn from clients. And finally, cultural safety. This goes beyond just do no harm. It's actively creating a virtual environment where a client feels their identity, their culture, experience everything is safe, affirmed, not challenged, making sure they feel secure, even through a screen.
It's clear these aren't just nice-to-haves. They're ethically required. The ACA Code from 2014, for example, really pushes counselors to develop multicultural competence and understand their own cultural biases. And like you said, that ethical responsibility gets a whole lot more complex when those interactions are happening through technology, doesn't it? Okay, let's shift gears a bit and talk about access, because a major roadblock here is the digital divide. This isn't just about having a phone or computer. It's about real gaps in broadband access, digital literacy, even just having the right tech. And this hits rural and low-income communities particularly hard.
Oh, absolutely. And the data really paints a clear picture. Research consistently finds lower telehealth use among folks who are uninsured, from racial and ethnic minority groups or non-English speakers. If you look specifically at video telehealth, the gaps are pretty stark. Hispanic, Asian, and Black individuals use it at significantly lower rates than white individuals. These aren't just numbers. They reflect, frankly, deeper systemic issues that we have to actively tackle.
Right. So while the divide is a serious issue, telehealth does also offer some real potential for improving access overall. It can tackle those old barriers like lack of local providers, transport problems, work schedule conflicts. It breaks down geographical limits. But the key, it seems, is that it has to be designed and rolled out intentionally with equity front and center from the start. And speaking of intentional design, that brings us to cultural adaptation. This is about systematically changing interventions, treatments, programs so they truly fit the cultural, linguistic, and context-specific needs of different groups. It's way more than just translating flyers, right? It needs deep cultural insight, real community involvement to make sure treatments are effective and feel relevant and accessible.
It's exactly right. A great example is the iSupport program for dementia caregivers. It was adapted in over 30 countries. The key was involving local people, caregivers, community leaders right from the start, using focus groups, really listening to make it fit their context. Another example is with ABA-based treatments. Adapting them involved translating materials, yes, but also training providers in the client's languages, sometimes even matching trainers and clients by ethnicity. These adaptations are absolutely vital for telehealth to work globally.
We've talked about adapting for different cultures, but people aren't just one thing, are they? Identities are complex. This is where intersectionality becomes such a powerful lens. It helps us understand how different social identities, race, gender, class, orientation, disability, and so on, overlap and interact to create unique experiences, unique challenges with mental health, unique ways people access or can't access services. And it's important to remember this framework has its roots in Black feminist scholarship.
And what's really insightful is how this framework helps practitioners in the telemental health world. It pushes us to see and address the systemic barriers that hit marginalized groups harder. Think about it. Limited tech access plus cultural stigma around therapy. That combination can really pile on the disadvantages for someone holding multiple marginalized identities. This lens helps identify groups most at risk, like Black immigrant families or Latinx communities facing multiple layers of barriers. So intersectionality isn't just theory. It directly informs how we create targeted interventions and policies for better equity.
And these individual and group challenges connect directly to the bigger picture, to social determinants of health, those broad factors like income, education, neighborhood safety that shape how people engage with and benefit from telemental health. It's all connected.
Yeah, and it raises the question, how do these broader factors actually impact outcomes? There was research comparing lower and higher income individuals in telepsychiatric care for depression. Both groups got better, which is good news. But the lower income groups still had more severe depression symptoms later in treatment. It suggests income gaps do affect telehealth outcomes, maybe needing extra support for some folks. And other research found that things like economic stability and even the physical environment during the pandemic predicted how easy patients found telehealth technology to use. So understanding these links helps providers anticipate and tackle barriers more effectively.
Okay, so given all these layers, cultural nuances, access issues, social determinants, how are we actually preparing professionals? Let's talk about training. How are virtual programs helping build cultural competence for this new landscape?
Well, virtual training is definitely showing promise. There are studies, for instance, with nurse educators showing significant improvement in cultural competence scores after virtual programs. These programs often use interactive methods focused on awareness, sensitivity, and those crucial cross-cultural communication skills. And what's really exciting is the use of virtual reality, or VR. VR offers this high level of immersion. It can really help build cultural awareness and challenge misconceptions by letting trainees experience different perspectives in a safe, controlled way. Think about 3D virtual worlds. They allow for experiential learning, social interaction across cultures, knowledge sharing. It goes way beyond just reading about it.
That's fascinating. And it doesn't stop there, right? There are other tools like embodied conversational agents, ECAs, virtual patients, essentially.
Exactly. They let therapists practice those tricky cultural conversations in a simulated setting.
And things like collaborative online international learning, COIL, connecting students or professionals across borders for direct cross-cultural interaction and understanding, really innovative approaches. So these training methods and the whole practice of telemental health, they're also guided by professional standards and ethics, aren't they?
Absolutely. And what's important is how standards are evolving. Take the KCREP, that's KCREP 2024 standards. They now specifically push counseling programs to ensure students grasp how cultural factors play out in technology-mediated relationships. It's a core competency now. Similarly, the NBCC Code of Ethics emphasizes respecting everyone's dignity and avoiding discrimination based on race, culture, socioeconomic status, all of it. In telemental health, this means we must actively pay attention to how things like tech access and digital literacy intersect with culture and therapy outcomes. We have an ethical duty to make sure the technology itself doesn't become another barrier.
So pulling this all together, what does moving forward look like? What are the concrete strategies for implementing cultural responsive telemental health successfully and equitably?
Well, it really requires action on multiple fronts. Policy changes are huge things, like making sure telephone visits are reimbursed alongside video, and serious efforts to expand broadband access. That helps bridge the digital divide. Then there are what we call community-centric approaches. This means truly partnering with communities, listening to their needs, their barriers, and co-designing interventions that make sense culturally and practically for them. That builds trust and effectiveness. And finally, we need telehealth systems that are genuinely easy to use, especially for economically marginalized patients. This includes offering support for learning digital skills and making sure people have the necessary tech and internet connection. It's about meeting people where they are.
It sounds like it really needs that integration, bringing different pieces together. So thinking about sustainability, how do we make this stick for the long haul?
I think integrating cultural adaptation work with the principles of implementation science is crucial. It helps us figure out which adaptations are needed and how to make them, without losing the core effectiveness of treatments. It's that balance between fidelity and fit. Look, challenges definitely remain, ensuring true cultural safety online, overcoming infrastructure gaps, maintaining treatment quality with adaptations. It's ongoing work, but the field is moving forward. It requires real collaboration between providers, researchers, policymakers, and communities themselves. It demands a commitment to partnership, continuous learning, and being flexible as we learn more. It's quite dynamic, actually.
As you think about today's deep dive, consider these questions. First, how might the concepts of cultural humility or intersectionality inform your initial assessment or ongoing therapeutic relationship when working with clients via telemental health? And second, considering the discussed access barriers and social determinants of health, what practical steps could you take to promote equitable telemental health service delivery in your specific professional context?